Today we'll be talking about habit reversal training. Trichotillomania is a fairly common disorder, affecting about 2.5 million people in the United States. However, trichotillomania is a disorder that is not paid attention. Trichotillomania is often noticed in late childhood or early adolescence, averaging at about 13 years old. The disorder is more common in women than men, with a ratio Trichotillomania is a disorder where people pull hair from the body, which includes the scalp, eyelashes, eyebrows, or pubic areas of the body. In order to be diagnosed with this disorder, the sufferer needs to pull one's hair to the point of hair loss, with multiple attempts to stop the pulling. Additionally, the hair pulling and loss of hair must bring about distress to the person. Hair pulling consists of either automatic or focused behaviors, which refers to how, when, and why people pull their hair. Automatic pulling happens outside of awareness, with the person realizing the behavior only after the fact. On the other hand, focused pulling is intentional and seems to be a response to a bodily urge. People who engage in focused hair pulling may feel tension before they engage in the behavior. Sufferers may engage in this type of pulling to alleviate negative feelings and moods. After the pulling behavior is completed, the person may feel pleasure or relief because this behavior is used in response to stress and negative feelings. According to the behavioral view of trichotillomania, pulling behavior is a form of negative reinforcement because of Trichotillomania can be quite harmful. The disorder brings about a lot of anxiety, which can cause disruption of the individual's daily life, especially if the individual starts to avoid situations where hair loss may be noticed so as not to be criticized by other people. Individuals who suffer from trichotillomania often report lower Trichotillomania is a chronic disorder, so it cannot be cured. So instead, treatments focus on coping skills and relaxation techniques. Habit reversal training is a behavioral treatment that aims to alleviate repetitive behaviors and tics that are centered around the body. This kind of treatment targets awareness training, social support, and competing response training, as well as self-monitoring. Habit reversal training uses competing responses along with relaxation to attempt to interrupt the sequences that lead to the pulling behavior. Through self-monitoring, the therapist and the patient identify conditioned cognitive, sensory, environmental, and affective cues that bring about hair pulling and replace the pulling with more adaptive and beneficial. Trichotillomania can cause great distress in people who suffer from this disorder. However, research suggests that behavioral therapies are some of the more effective techniques for this disorder. Even though habit reversal training is very effective in treating trichotillomania,